Gypsy, Roma and traveller communities are known to face some of the most severe health inequalities in the UK. But to improve our understanding of the health of these communities and the care we provide them, we first need better collection and quality of ethnicity data. Across the UK, Gypsy, Roma and traveller ethnicities, and others that sit under those umbrella terms, are not always included as an option when patients need to choose an ethnicity category in healthcare services, such as when registering at a GP. However, even where accurate ethnicity categories are available, people in these communities may choose not to declare their ethnicity honestly due to social exclusion and barriers to access in healthcare services, such as mistrust due to long-standing discrimination, lack of cultural awareness amongst staff, or differences in language and communication needs. Understanding Patient Data wanted to explore these factors and how to address them through engagement with these communities. That's why we commissioned researchers at University of Worcester, in partnership with Gate Hearts, a Gypsy and traveller-led community organisation, to design and carry out a research study. The aim of the study was to better understand the attitudes and perspectives of Gypsy, Roma and traveller communities on the collection of their ethnicity data in health services, and to develop recommendations to ensure that these groups are better represented in health data in the future.
So what are the current issues in regards to collecting ethnicity data across Roma, Gypsy and traveller families?
Well, I think firstly is fear of putting their name to a list. The Roma Holocaust is in living memory, and people still have that fear of authority. I think that for me, I understand why collecting data is important. Services needed to be adapted for communities, but everybody doesn't understand that. They think, I'm just going on a list, what are they going to do with that data?
At the moment, England is very, very diverse, and myself personally, I have the assumption that the NHS know about all cultures other than the Gypsy, Roma and traveller cultures. I believe that the NHS should know fully about our cultures so they have more of an understanding.
So do you think that the NHS should ask Gypsies, Roma and travellers about their ethnicity when they come to service as new patients?
I think it's important to ask. People have a choice whether they want to give that answer or not, but it's still important for them to ask because they need to know who's coming through their services, how they can adapt their services.
What level of awareness, Josie, would you expect all health professionals to have about Gypsy, Roma and traveller communities, particularly if there's a significant population in that area of a certain culture? What should they know?
Well, firstly, I think they should know about the culture. They should know the different groups that are grouped under that umbrella term. GRT is used a lot, which we're trying to get away from. I know for written purposes, some people still use GRT, but they should know at least who is the G, who is the R, who is the T. They have to know that to be able to make their services adapt them for people that need them.
Yeah, GRT lumps them together as if they're all the same.
Yes.
Just like BAME is no longer used, is it? Because it aggregates everyone together, whereas many of the Gypsy cultures are quite different. The traveller cultures, the Roma cultures, and
completely different.
Some of the trouble with the information that's collected on Gypsy, Roma, traveller is that it's not always available. The option to identify as Gypsy, Roma, traveller isn't always there, and if it is, it's lumped together. Another problem is that there are people self-identifying different ways. So we might have a community that feels Romani Gypsy is the correct terminology, where another family might say Gypsy or Romani. So it varies.
Right. So what steps could be taken to better encourage Gypsy, Roma and travellers to feel safe and secure in declaring their ethnicity to a health or social care service?
I think that Gypsy and traveller organisations have a responsibility there to educate the community on why people are collecting their data.
Within ethnicity declaration, I feel that if the question is broken down and if these Gypsy Roma and traveller communities are told the reason to why the ethnic data needs to be collected, instead of leaving them thinking that they will be discriminated against or they feel that the services will be reduced, let them know the reasons to why it needs to be collected. Let them know that help can then be sourced once they know what the issues is within these communities.
We need to consider the receptionists, the dentists, people in A&E, and all of the various, even the cleaners, the ladies that serve the meals. All of these staff members needs to have a basic understanding, cultural training, and we also should have intranet pages that staff members can go, and if they want to learn more in their own time, or those resources should be available because they exist, and I think there should be a way or a space that collates all of that information and also has videos and webinars available.
The next section of video will outline the key findings and recommendations that came from the surveys and the focus groups we held with Gypsy, Roma and Traveller groups across the UK. The first slide talks about the level of cultural awareness that was perceived to be held across health services. And as you'll see from the slide, only 5% of participants thought that staff were well informed, 7% thought that they were adequately informed, 23% thought that they were not well informed, 51% thought they were poorly informed, and 40% didn't really know, didn't really have a perspective on the issue. The next slide represents the perspectives held by community members about their experiences of health services across the UK, and 12% reported having very good reception and care, 23% said it was good, 35% said it was fair, 22% said it was bad or very bad, and mixed experiences, not quite sure how to categorise it in terms of how the ethnicity was approached. Did they have a choice? The welcome they got, and indeed the service they got, the way it was communicated with in general. 2% weren't quite sure. And now for a summary of the recommendations, which you can read in greater detail on the actual report, the link of which is at the end of this video. And the first recommendation is that ethnicity data should be collected to justify positive social action and enable health service planning. The second one was that self-identification, how people perceive their own ethnicity, is the generally suggested approach to collecting ethnicity data. The third recommendation, that communication should be shifted, the way we communicate with community members about appointments and other health services related information, from a traditional postal letter based approach to using phone and text messages, the types of format that many community members are much more comfortable with and much more likely to respond to. The fourth recommendation is around building more meaningful connections with trusted local Gypsy, Roma and traveller organisations, so as to encourage them to feel safe and secure, and understand the reasons perhaps why ethnicity should be declared to enable better health planning and better service. Unfortunately, there aren't that many specific Gypsy, Roma and traveller organisations around the country, but there are in certain places, and the national bodies can always assist as well. So the fifth recommendation is that health services, charities and organisations wishing to engage Gypsy, Roma and traveller communities should initially aim to plan and carry out health improvements with the active involvement of women from the communities. And much as we're not suggesting dismiss the men from the communities, the reality of the current level of engagement by men in all matters health, social education is so low that really women are seen as the movers and shakers, at least in the short term, if we're going to effect change in terms of access to health services and take up of health services, and indeed hopefully lead therefore to better health outcomes across the communities. Because we found so many different categorisations being used across the NHS services for ethnic categorisation of Gypsy, Roma and travellers, we came up with a recommended standard list, which is as follows: English Gypsy / Romany, Irish Traveller, Scottish Gypsy Traveller, Welsh Gypsy / Romany, Roma and English Traveller. These categorisations came from the research with significant numbers of community members, and we very much hope that health services and the requisite IT systems could incorporate these categorisations without too much delay, and therefore play a part in helping eventually improve the health outcomes of the communities.
We hope that this research will promote awareness of the importance of greater expansion and inclusivity of ethnicity categories in healthcare services, not only to understand the health of these communities better through research, but also to provide more culturally informed care by healthcare staff. We'll be using this research to drive conversations with policy and decision makers around making changes to ethnicity categories, and we're exploring options for producing community-facing resources that communicate the importance of accurate ethnicity data for improving health and care. Everyone deserves to feel able to be honest and accurate about their ethnicity, and to understand why this is important for their own and their community's health and care.